So I wash my hands and down the appropriate PPE. Hi, my name is Francesca. I'll be your student nurse today performing your physical exam. I close the curtains and shut the door to ensure your privacy. How are you feeling today?
I'm good.
Good. If I could just see your ID band. If you could state your full name and birth date.
John Smith, February 7th, 1992.
Perfect. It all checks out. And if you could tell me where you are and why you're here today.
I'm in the hospital. I'm here for a physical.
Okay, perfect. And today's date?
February 28th, 2021.
Very good, okay. And I see that your posture is upright, your hygiene is appropriate, and you look well groomed. Coming in today to the exam room, your gait was steady. Moving on to your skull. Your skull looks round and contour is even. Hair is distributed evenly. Now I'm just going to lightly palpate it. Let me know if you feel any pain or tenderness.
No.
Okay, good. And I felt no disformities, and your hair texture was soft. Okay, and moving on to your face structures and your bony structures. They look appropriate for your age. Skin color is appropriate for your race. I see no lesions, bruising, or scarring. And now I'm just going to lightly palpate to see if you have any pain or tenderness.
Nope.
Okay, and I felt no disformities also, and it felt appropriate for your age, okay? I'm gonna do some cranial nerve tests. If you could just smile for me, okay? Clench your teeth, puff out your cheeks, okay? Stick out your tongue, okay? Wiggle your forehead, and then close your eyes tightly. Perfect. Now I'm just gonna touch your forehead. Let me know if you feel it.
Yep.
Okay, over here.
Yes.
Good, so your cranial nerve tests are intact. Okay, and now I'm just gonna move on to your face structure. So your eyebrows, your hair is evenly distributed and they look symmetrical bilateral. Your eyelids look intact, they're symmetrical bilateral also, and your eyelashes look evenly distributed, the hair. And then if you could just pull down your eyelids for me. Okay, good. So your conjunctiva is pink, scleria is clear and white, and your iris is blue and round. Okay, now we're just going to do a couple of tests with your eyes. Okay, if you can just follow my pen light without moving your head. Perfect, okay, so extraocular movement is intact. And now if you just look straight at me. Okay. Perfect, okay, and then if I could have you cover one of your eyes. Okay, how many fingers am I holding up?
2.
Okay.
3.
Awesome. Next eye, if you could cover it, please.
1. 2.
Perfect, okay. And then if you could just stare at my pen. Perfect, okay. And then cover your right eye for me, please. Okay, and let me know when you see my hands wiggle.
Yep.
My fingers.
Yep.
Okay, next one.
Yep. Yep. Yep.
Okay, perfect. So your visual acuity was intact, your visual fields was full, and we were perla, and consensual reaction was intact, okay? Perfect. And now we're going to move on to your nose. So your nose is midline, septum midline, and let me save it. Okay, and I see no discharge with it, and your turbinate is pink. And then with your ears, the size looks appropriate for your age. No swelling, edema, or red streaks that I see of. No discharge in the canal. And I'm just going to lightly touch. Know if you feel any pain.
No.
Any pain there?
No.
Perfect. Okay, I also felt no bulges or swelling lymph nodes also. And then I'm just going to do this. Let me know if you hear it.
Yep.
Okay.
Yes.
Okay, so gross hearing is intact. Moving on to your mouth then. Your lips are pink. The moisture is appropriate. They're symmetrical. And then if you could just smile for me. Okay, perfect. Teeth are white. And I see no chips or broken teeth. And all your teeth look present. Your gums look pink. You just say ah for me. Move your tongue. Okay, so tongue movement is appropriate. Tongue is pink. Your buccal mucosa is pink. Your uvula is midline, and your palates rise equally. Okay, and now we're going to move on to your neck. Your neck looks symmetrical. And I see no disformities. If you could just move it to the right and left, up and down. Perfect. Range of motion is intact. I'm just going to feel for your trachea. Okay, trachea is midline. Awesome. And now I'm going to put my hand here. If you could just go against it this way. Okay, other side. Okay, and if you could shrug your shoulders. Perfect. So your neck and deltoid strengths are intact. Okay, so now we're done with the neck. We're going to go on to the carotid pulse on this side, which is present +2. And the other side is also present +2 for the carotid. Okay, and now we're going to move on to your upper extremities. So you just head out your hands. Okay, so your skin color is appropriate for your race. I see no lesions, bruising, or scarring. Feel for your temperature. It's normal range, bilateral. And let me know if you feel any pain or tenderness.
No.
No pain or tenderness. Very good. I felt no disformities with that. Okay, now you can put them down. I'm going to check some of your pulses, your radial pulse on both. Present +2 bilateral. And then your pulse up here is also present +2 bilateral. And I'm just going to feel right here for your lymph nodes. Do you feel any pain or tenderness?
No.
Okay, so no pain or no swelling that I feel of for your epitrochlear lymph nodes. All right, and then we're going to do some of your strengths with your arms. You could go like this for me. Okay, push towards me, towards you. Squeeze my hands. Squeeze them for me. Good. Okay, so your upper extremity strength is a 5 out of 5 bilateral. And now I'm going to do your bicep reflex. You just relax your arm. Just gonna knit it. Okay, other side. All right, so they're both present reflex bilateral. And then moving on to your hands. I see your hands are also appropriate color for your race. Moisture is appropriate. Your nails look appropriate thickness. They are round and smooth. And temperature is in normal range, bilateral. And I'm going to check for capillary refill, which is present, with it refill being less than 2 seconds. And if you just do this with your fingers, we assess for clubbing. Okay, so no clubbing of the fingers that I see. Good. Okay, so now we're going to move on to your posterior chest. If you could just move sideways. Yep, that's perfect. Okay, so assessing your back, your muscles look appropriate for your age. Skin color is appropriate for your race. I see no lesions, bruising, or scarring. Your shoulders look symmetrical. Bilateral. Scapular placement is even. Your spine is midline. And I'm just going to palpate now down your vertebrae. Okay, it seems straight, midline. Your posture is upright. And now just let me know if you feel any pain or tenderness.
No.
Okay, perfect. And now we're going to do vocal fremis. When I put my hands on your back, just say 99.
99.
Okay.
99.
One more.
99.
Okay, so vibrations are equal bilateral. Now I'm going to do the expansion. If you could just take a deep breath in with your mouth open. Oh, good. So your expansion was equal bilateral. And now I'm just going to lightly tap on this side. Just let me know if you feel any pain or tenderness. Any pain with that?
No.
Okay, so no CVA tenderness, my bad. Okay, and now I'm just going to listen to your lung sounds. So when I put it on your chest, just you can take a deep breath in and out with your mouth open, please. Okay. Good. So your posterior chest is clear to auscultation. I'm just going to check the lateral side. Take a deep breath in again. Okay. And then the other side. Okay. Okay, the lateral sides are also clear to auscultation as well. Okay, if you could turn back around, we're just going to do your anterior chest now. So looking at your anterior, your posture is upright, your respiratory movement looks regular, your breathing is unlabored. Skin color is also appropriate for your age again, no lesions, bruising, or scarring. I see no pulsations or heaving on the precordium also. And I'm going to do the same thing I did on the back with the vocal frematus. Just say 99.
99.
Okay.
99. 99.
Okay, so vibrations are equal bilateral again. And listen to some lung sounds on the anterior. Okay. Just breathe in and out. Thank you. Okay, so your anterior chest is clear to auscultation. I'm going to listen to your heart sounds now in 5 different locations. You just relax for me. Okay, your heart sound regular. S1 and S2 was present. S3 and S4 were not present, and murmurs were not heard either with that. Okay, and now I'm going to have you lie down for the abdominal part of the exam. Thank you. Make sure that's good. Okay. So assessing your abdomen, skin color is appropriate for your race. Muscles are appropriate for your age. I see no lesions, scarring, or bruising. No pulsations or peristalsis. Your contour is flat. Okay, and now I'm just going to listen to some bowel sounds. Well, for that, can I have you put your head towards your chest a little bit for me? Just checking your muscles. Okay, then put it back down. So no bulges of hernia that I saw. I'm just going to listen to some bowel sounds. Just in each quadrant. All right, bowel sounds were present in each quadrant. Now I'm going to listen to your vascular sounds for no brewing. I'm going to change to the bell. Okay. And your femoral pulse. All right, so no brewing that I heard of, and I'm going to palpate the femoral pulse. Okay, and that was present bilateral +2. And then palpating the inguinal region, I feel no swelling or hernias in that region also. Okay, so now I'm going to have you sit back up for me, please. Good. Did you have any trouble sitting up?
No.
Good. So, and it looked like you're well coordinated sitting up from the lying to sitting position. Okay, so now I'm going to move on to your lower extremities. So just assessing your legs, skin color is appropriate for your race. I see no lesions, bruising, or scarring. They look symmetrical, bilateral. Okay, and now I'm going to do some strength tests. So if I could have you just lift your knee up against resistance. Okay, and then also push towards me, go towards yourself. Okay, so lower extremity strength is 5 out of 5 bilateral. Now I'm going to do your patellar reflex. You just relax your leg for me. Okay, okay, next one. Okay, so patellar reflex is present bilateral. And now I'm just going to palpate down your legs. Let me know if you feel any pain or tenderness.
No.
Good, and I felt no disformities, and I see no vascularity on your legs, and no edema that I see of. I'm going to check for pitting edema now. Okay, so no edema was present bilateral. And then also your temperature with your legs and feet is with normal range. Okay, and then assessing your feet, I'm going to check some pulses. Your posterior tibial pulse, which is present +2 bilateral. And then the pedal one on top is also present bilateral +2, all of them being +2. And now I'm going to check your capillary refill. Capillary refill is present, being +2 bilateral. And then that is the end of our physical examination. Thank you.
Thank you.